talking about the fourth component of our program in the psychoeducational groups. The philosophy we have there is understanding is knowledge, and knowledge is the power to change. That's what we teach in the psychoeducational groups. What we want to do in the group psychotherapy groups is apply what they learned in the educational component. So in group psychotherapy, we have everybody here who initially comes in having significant or issues in their own lives as it relates to one of four categories, which is what we're interested in terms of what we look at. Primarily, their health issues as it relates to their substance abuse. The health issues, regardless of what substance they're using, for the most part, the substance they're using has some impact on health, whether it increases their risk for an overdose, as in an opiate, or whether it increased all kinds of factors with regards to alcohol or marijuana abuse. All of them are health-related issues. We have them understand that in the psychoeducational group, and then when they bring that up in the therapy groups, one of the questions we ask is, how are your health-related issues as you understand them to be impacting on your lives? And what impact does this have with regards to your thinking, your feeling, and your behavior? So those are the areas obviously that CBT deals with. And we're interested in how is it impacting your health? Because for the most part, our patients don't understand that. There is a medical condition, a neurological condition, and for years people have believed that people with an addiction are in denial. That means they're unaware that they have some type of a medical or a physical condition. And denial is a psychological process that won't allow them to see that they have a substance abuse disorder. In reality, we don't think that denial is a big part of what it is we have, because that's a psychological process. What we believe is what's called anosognosia. That's a neurological condition that primarily prevents people from seeing that they have a medical condition of an addiction, which means they would minimize the impact that their addiction has in the health area. They would be physically or neurologically unable to grasp the gravity of their medical condition. Consequently, they would continue to use. So when we look at anosognosia, which is a neurological condition, which is different than the denial concept, or if we go one step lower, everyone who deals with someone who has an addiction, they believe they lie about it. We talk about these concepts in a group psychotherapy process so that that knowledge then becomes power where they can change that. So we've gone from a patient who believes that they're lying about their physical condition to they're in denial, they don't understand it. In reality, they may have a neurological condition that prevents them from understanding that they have a health issue that's related to their addiction. The second area that we talk about in group psychotherapy may be some type of a legal problem. If you have a simple DUI or one or two DUIs, driving under the influence, that then constitutes a legal problem, and we need people to if you will, understand that that may be a mental health issue, or maybe an issue that needs to be dealt with in an unemotional manner. We have legal problems that people need to talk about, and for sure the other two that we look at in our group psychotherapy sessions are relationship issues. This is the primary problem that we deal with our patients in terms of how do I deal with my spouse, how do I deal with my mom and dad, how do I deal with whomever I'm working with, because addiction always has an impact on relationship issues in terms of the integration of their emotional condition in response to your physiological condition of an addiction, because they don't understand. We'll get to that in number 5 in terms of the family dynamics or family support group, but this is one of the primary issues that we deal with in group psychotherapy in terms of what about my substance abuse issue or my mental health condition is interfering with my relationship with other people. And the fourth area that we deal with is vocation, in terms of our patients who are using substances on a regular basis may have lost multiple jobs as a result of their addiction issues, and it certainly shows up in people who switch jobs or get terminated from employment as a result of their substance abuse. And our patients have the opportunity to discuss that in a relationship with other people who've been in some of these same situations. So the group psychotherapy is intended to discuss what other type of significant issues do patients bring to the table that we can discuss so that other people can identify with, and thus decreases the intensity they have about, I'm the only one that feels this way, I'm the only one that acts this way. In reality, Most of our patients have very similar issues. They're just unique in these areas: health, legal, relationship, and vocational issues that we bring up in a group psychotherapy format.